Hi, so we're going to be presenting about obsessive compulsive disorder, um, and Simryn and I are going to be presenting about it.
So OCD is an obsessive compulsive disorder in which people have reoccurring unwanted thoughts, ideas, or sensations that make them feel to do something repetitively. These obsessions and compulsions can interfere with one's daily lives and cause distress. OCD symptoms can include both obsessions and compulsions. Obsessions can be repeated, persistent, unwanted thoughts. There can also be urges or images. Individuals will perform compulsive behaviors to rid of these obsessions. Compulsions are repetitive behaviors that individuals feel driven to perform. These are meant to reduce anxiety, but it only offers temporary relief. There are behaviors that individuals perform in response to an obsession. The severity of OCD symptoms can vary throughout a lifetime. The types of obsessions and compulsions that individuals experience can change over time. Symptoms can worsen with greater stress. Individuals can experience mild to moderate symptoms or be severe to the point that it's time consuming and disabling.
So the common themes of obsessions are fear of contamination or dirt, doubt and having difficulty like tolerating uncertainty, aggressive or horrific thoughts about losing control, needing things orderly and symmetrical, unwanted thoughts, which includes aggression, sexual, or religious subjects. So examples of these obsessions, signs and symptoms would be fear of being contaminated by touching objects that others have touched, doubts that you've locked the door or turned off the stove, intense stress when objects aren't orderly or facing a certain way, images of driving your car into a crowd of people, thoughts about shouting, obscenities or acting inappropriately in public, unpleasant sexual images, avoidance of situations that can trigger obsessions such as shaking hands, fear of blurting out insults, or fear of losing or discarding something important. Some common themes of compulsions would be washing and cleaning, demanding reassurance, counting orderliness, following a strict routine, or checking. Some examples of this would be washing your hands until your skin becomes raw, checking doors repeatedly to make sure they're locked, checking the stove repeatedly to make sure it's off, counting in certain patterns, silently repeating a prayer, word, or phrase, arranging your canned goods to face the same way, excessive or ritualized hand washing, showering, brushing teeth, or toileting, repeated counting to a certain number, constantly seeking approval or reassurance, or repeated cleaning of household objects. So the clinical course for OCD would be, as a nurse, to establish relationship through empathy, warmth, and respect, demonstrate interest in the client as a person. The next thing to do would be acknowledge behavior without focusing attention on their OCD, verbalize your empathy towards their experience rather than showing disapproval or criticism, assist the client to learn stress management, identify what the client perceives as relaxing, help engage them in constructive activities that require construction. The next step would be to assist the client to find ways to set limits on their own behaviors, encourage clients to explore meaning and purpose of their behaviors, such as when it occurs or precipitating factors. And next, discuss the home situation and include family or their partners. Also include a discharge plan and administer prescribed medications as needed. So diagnosing OCD would include a psychological evaluation. You would note their thoughts, feelings, symptoms, and behavior patterns to determine if the individual has obsessions or compulsions that get into their everyday life. Um, there's a diagnostic criteria for OCD. The Diagnostic and Statistical Manual of Mental Disorders can be used as a criteria. It's mainly used by doctors, and the physical exam can help rule out other problems that could be causing these symptoms. So this is the diagnostic criteria of OCD from the DSM-5. The criteria includes presence of obsessions, compulsions, or both. Obsessions and compulsions are time consuming. The obsessive compulsive symptoms are not attributable to effects of substance, and disturbance is not better explained by the symptoms of another mental disorder. So OCD is commonly mistaken for other mental illnesses that individuals have.
Some possible screening questions that the doctor might ask a patient can include: do you wash or clean a lot? Do you check things a lot? Is there any thought that keeps bothering you that you would like to get rid of but can't? Do your daily activities take a long time to finish? Are you concerned about putting things in special order, or are you very upset by a mess? And do these problems cause trouble to you? Some common risk factors can include age. It's common in older teens or young adults. It can begin in preschool age or as late as the age of 40. Another risk factor is genetic factors. This may play a role for some individuals. Having relatives or family members with OCD will increase one's risk. Stress can also play a factor. This can make OCD symptoms appear. Major life events such as loss of a loved one, divorce, relationship issues, or abuse can cause OCD to happen. Um, Presence of other mental conditions is also a risk factor. OCD usually occurs in people who have other mental illnesses such as anxiety disorder, depression, Tourette syndrome, ADHD, or eating disorders, and more. And the final one that is a risk factor is pregnancy and postpartum. Certain hormones can trigger OCD symptoms. OCD can worsen with pregnancy, and postpartum can include constantly worrying about the baby's well being. So the etiology of OCD includes biology, genetics, and learning. For biology, OCD can result from an individual's body chemistry or brain functions. In genetics, OCD can have a genetic component, but it has not been officially identified yet. And learning includes learning obsessive fears or compulsive behaviors from other family members, or it can also be gradually learned over time. Some treatments include psychotherapy, which is CBT, which is also known as exposure and response prevention. During sessions, patients are exposed to fear situations or images that focus on their obsessions, which will lead to increased anxiety. Patients are instructed to avoid performing their usual compulsive behaviors. This will allow patients to learn that their fearful thoughts are just thoughts and nothing more than that. Self-care is also a treatment. Individuals can maintain a healthy lifestyle to help cope with OCD. Self-care can include basic relaxation techniques such as meditation, yoga, visualization, and massage. Neurosurgical treatment is also one. It can help include deep brain stimulation and anterior capsulotomy. This is deep brain stimulation that helps treat people with severe OCD. Intensive outpatient and residential treatment programs also, our comprehensive treatment programs can emphasize exposure and response prevention therapy principles that can help with individuals who are struggling to function. Deep brain stimulation can involve implanting electrodes with certain areas of an individual's brain that may help regulate abnormal impulses. And a final treatment includes transcranial magnetic stimulation, which is a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain to improve symptoms of OCD. An electromagnetic coil is placed on an individual's scalp, which delivers a magnetic pulse that stimulates nerve cells.
Okay, so some medications, the most common one would be a selective serotonin reuptake inhibitors, also known as SSRIs. They're a very common antidepressant. They can be used to treat depression, but also OCD, and the dosage is higher for treating OCD. This is the first class of medications that are used. So some antidepressants include clomipramine, fluoxetine, fluvoxamine, paroxetine, and sertraline. Some other medications would be citalopram, acetylopram, and venlafaxine.
Some side effects of medications can vary from medication to medication, and the dosage of these medications will also vary. Something to consider is choosing medications that control your symptoms with the lowest dose will take weeks to months before finding the right one. Most antidepressants can cause an increase in suicidal thoughts or behaviors. Antidepressants can have interactions with other substances, and stopping antidepressants abruptly can cause physical dependence and discontinuation syndrome. Some possible side effects of SSRIs are confusion, agitation, indigestion, muscle twitching, loss of appetite, insomnia, erectile dysfunction, sweating, shivering, and diarrhea.
So next, nursing interventions and assessments for OCD. Some nursing interventions are limit but do not interrupt compulsive acts, teach the client to use alternate coping methods to decrease anxiety. Nurses must have consistency to approach care for these patients, assess the client's needs carefully, provide an environment that has structure and predictability as a strategy to decrease anxiety, make reasonable demands, set reasonable limits, and make their purpose clear, observe when interventions don't work, reevaluate and recommend alternative strategies, engage patient in activities to create positive accomplishments and raise their self-esteem and confidence, keep their physical health in mind. Things like compulsive hand washing can cause skin breakdown, and rituals can cause inadequate food or fluid intake. Provide these basic needs such as rest, nutrition, and grooming if patients are involved in obsessions or compulsions that lead to self-neglect. So some nursing assessments would be assess the patient's history with the disorder, such as assess their thoughts, images, or words, determine the patient's personality type, such as obsessional personality, evaluate the impact of their obsessive compulsive disorder on their normal routine. This can impair their social and occupational functioning, and assess the patient's level of anxiety and disability, especially if the patient is unable to express these feelings verbally. And these are our resources. Thank you.
Thank you.